Now, South Africa's COVID-19 numbers are apparently increasing at an alarming rate. The Health Minister, Dr. Zweli Mkhize, is very concerned about this, and he joins us now. Minister, thank you very much for your time. Just first of all, tell us how big this increase is and why you're so concerned.
Well, our concern really arises from the fact that the numbers are increasing, but largely driven from one province, and that is the Eastern Cape. Since the beginning of September, we started seeing our numbers coming down to about 2,000 positive cases per day, and we continued like that until we went to about 1,000. But I think now the numbers have started changing. As of today, we've just crossed the 3,000 mark. We've got 3,105. Although, as we put those numbers, we need to understand that the numbers that we are testing are those who come with the symptoms that we use to determine who must be tested. But in this case, we've actually got this increase. It shows that the numbers are increasing in such a way that over 50% of those 3,000 are actually in the Eastern Cape. And that's why we've got quite a concern about it, because whilst we treat this as an outbreak out in the Eastern Cape, but it does pose a risk that if we don't contain it quickly, therefore it might result into a spread of this infection. At this point, we have gone to 762,763 positive cases. Now, that is showing an increase which we are concerned with, but also, whilst on the one side, our recovery rate is gone up to about 92.7%, we are concerned by the fact that we need to contain the numbers in the Eastern Cape. So we're putting up a plan. We'll be visiting the province again to go and support the province with more ministers so that we can actually focus on the community side, because we think there is a number of super spreader events that are generating these infections, and we've identified a lot of areas such as parties, particularly involving young people, particularly the students, and also some of the enjoyment places such as taverns and shebeens, where you have parties running at with overcrowded venues. All of these are very risky kinds of behaviors. We need to actually make our people understand that we cannot be tired of preventing the infection, because it can just get worse. And so that is the issue that we want to put on the table, that we are not over the woods, and the numbers are beginning to show that where the containment measures are not adequate, the numbers may start increasing. Yeah. In some of the provinces, there will be areas here and there where we see some numbers increasing, but they're still getting contained. But we are concerned about the one in the Eastern Cape, particularly because we have now breached the 3,000 number of positive cases. We've also noticed that also changed the positivity rate. All along, we've gone up to about 10 and a bit lower, 10%. Now we're starting to get towards 11%. So all the indications for a resurgence are beginning to appear, increasing number of positive cases, positivity rate, admissions, mortality, and ICU beds utilization. All of those are now the features that are a part of what we're seeing in the Eastern Cape.
Are the areas, as you outlined earlier this week when you were visiting the province, that it's the Nelson Mandela Bay area and the Sarah Baartman area, which I understand is the sort of northern part of the Garden Route? So we're talking Jeffreys Bay and also up into Grahamstown. Are those the hot spots that you're most concerned about?
Well, mainly Nelson Mandela Bay. Sarah Baartman has also shown numbers increasing, and we believe that its proximity to the Western Cape and the movement of the seasonal farm workers is a factor there. Buffalo City now and again shows numbers that are increasing, but the other parts of the province are also showing some slight increase. But the major thrust is with Nelson Mandela Bay. But in the 3,000 that we're talking about positive today, and we go back for the past few days, 45 to 50%, sometimes even more than 50% of those tests are tests that are positive from Eastern Cape.
We are less than a month away from the festive season. We know that the Nelson Mandela Bay area is a prime tourist destination. Earlier this week, I spoke to Premier Oscar Maboyane's advisor, and he explained that obviously the rapid testing process is being rolled out so you get a bigger, quicker picture of what's going on. But he also spoke about the need to really monitor people and their behavior. If things don't improve quickly, could there be a chance that you'll look at a tighter lockdown for a specific region in the Eastern Cape?
Well, we rather report on the basis of what steps we need to take at that point, because we still hope that we can contain the numbers. We are not foreseeing a complete lockdown for the country as such. But also in the Nelson Mandela Bay, we have actually said there must be a very strong enforcement of the restrictions in various areas where we believe that the risk areas are. When that fails, we will then have to evaluate at that point. We have even asked that they must give us a sense of the numbers that are caused by trauma, alcohol-related injuries, and all of that. We will evaluate all of that and take the necessary decisions when the time comes. But what is important is to say to our people, you know, there is no other way of delaying the spread of the infection or stopping or preventing the spread of the infection other than the use of masks, washing hands, sanitizing, as well as distancing. All of that together is important. This idea of people who will go on with enjoyment as though there's nothing that is wrong is a challenge. And in instances where people are coming for services, we still have to make sure that we maintain the queues so that there's distancing. All of those issues are still very, very important. We need that message to be heard very strongly, because for one person, they could themselves be infected and have a very mild infection or no symptoms, but the next person who will get it may actually lose their lives.
Absolutely, you're so right. We've just got to keep this in mind, and it is so easy to forget. I think everyone is so tired. Is this, and I ask this because we know that second waves in many countries are actually worse than first wave. Is this now absolutely the Eastern Cape's second wave? Is it now, in your mind, absolutely sure this is the second wave for the Eastern Cape?
Well, yes, let me say, in the Eastern Cape, if you look at all the provinces, they went over the surge and they started cutting down their numbers. Now, the provinces such as the Free State, the Northern Cape still had high numbers, but those numbers were a carryover of the first surge, which was which had delayed in the number of provinces. Eastern Cape had gone down to a point where the numbers were much lower. Now this is a new resurgence that we're talking about. And we are saying it's a cluster outbreak, but it can turn into a whole wave depending on how it is managed and how people are focusing on the containment measures.
Well, thank you very much for coming through to us this evening and just pointing to the urgency of this message. We do appreciate your time. That is our Health Minister, Dr. Zweli Mkhize, telling us that the new infections per day in the Eastern Cape have now surged to 3,000 a day, and he is stressing that we absolutely have to maintain the health protocols because we don't know when we've got the virus. I'll speak for myself. I tested for antibodies recently. I don't recall having any virus at all, but I have COVID antibodies. So you might not know when you have this virus. You might not know when you are infectious. So please listen to what the Health Minister is saying. You're watching eNCA. Stay with us.